Why do we blink? We blink in order for contacts to work. Blinking moves the contact up and down, in and out, and rotates with each blink. When we blink, new oxygen and fluid are replaced, keeping your cornea healthy. What else does blinking do? Blinking cleans the lens just like a windshield wiper cleans the windshield of your car. Blinking also keeps the lens in position and provides good vision. Causes of bad blinking: not wearing glasses, wearing an old prescription, wearing scratched contact lenses or lenses that do not fit properly, and not wearing sunglasses, all causing you to squint. All those things can lead to infrequent blinking, less than 15 times per minute, incomplete blinking, where the top lid does not touch the bottom lid. Contact wearers go through 3 phases of blinking. Phase 1, adaptation to contact lenses, frequent and deliberate, or sudden and deliberate blinking. Phase 2, normal phase 2 to 3 weeks later. In phase 3, they tend to blink infrequently and or partially, where the top lid just flickers. If the third phase continues, this can lead to a syndrome of fogging. Eyes are red at the 3 and 9 o'clock areas of the whites of the eyes. These areas are drying from exposure, and the blood vessels enlarge to bring in more fluids to moisten the area. This also causes the patient to develop yellow plaques on the whites of the eyes, from larger molecular cholesterol and calcium becoming clogged at the smaller sized vessels. Here are some pictures of what those plaques and red marks at the 3 and 9 o'clock areas look like. There are several things to do to improve blinking. It will take time, as this has taken years to develop, plus it's involuntary. Write down on a piece of paper 10 specific times when you're going to practice blinking each day, like when you're brushing your teeth, brushing hair, after work or after school. This will enable frequent, specific times throughout the day to practice. Each time you practice, blink 10 times. Blinking should be done to the count of 3. 1. Close the eye by touching the top lid to the bottom lid. 2. Pause. 3. Open again. This may seem a little exaggerated and strange at first, but once you learn to do this, it will come naturally. You should blink about 15 times a minute. Occasionally, place your finger on the outside corner of your lid and blink. With practice, you will not feel the pulling, which means it will look natural. Watch actors on TV and notice that they blink, but it does not draw attention to themselves. Remember, the whole goal of wearing contact lenses is to not appear as though you do. You must practice this so you'll have a natural and voluntary blink and appearance. We'll give you some doodads as a reminder to blink. Practice 10 times or more a day, 10 blinks each time. Remember to note 10 different times you can practice, like when you're stopped at a stoplight, TV commercials, between classes, after eating, end of a chapter you're reading, etc.